Hi everybody, it's Evelyn here again. For those who don't know me, my name is Evelyn. I live in Scotland, but I'm originally Dutch, and I'm a functional nutrition and lifestyle practitioner. And I also trained in herbalism and in naturopathy. And today I wanted just to for a short while, talk into something that happened this morning, which is that a friend came around and we started to chat, and he was asking me about the work I do, and then he said, yeah, it sounds like really good, but I'm not booking an appointment with you because I know what you're going to tell me and I don't like it. And so it was really funny because, yes, probably when people start working with me, I'm going to ask them to change something in their life, and change is not so easy for us humans. We can get really resistant to changing, and what I notice, a lot of clients who come to me have done, have followed several strategies before they came. So some people have been doing a lot of uh, Googling and going on Facebook groups to find out what other people did that helped them. And then they try to do the same, but of course, what works for one person doesn't necessarily work for another person. And there's so many choices, like all the herbs and supplements and the protocols, and somebody can try something and it might work for them, and it might also work for them for a week, and they post a happy post, but then a week after it stops working, and they never tell you. So this that can be quite tricky. And then so other people have done a lot of testing and trying to find out what's wrong with them, and they hope that when they find the one thing that's wrong with them, they can correct it and they will be fine again. But especially with people with chronic illnesses, it's not so straightforward. There's usually not one thing that's wrong, because something's wrong and then something's off, and then something else goes wrong or it goes off, and then it gets quite a complex picture. So that's another one that's not so easy. Or people try lots of supplements and herbs, and it gets really hard to work out where you need to go. So that's where I can come in with my support. And yes, it might require you to change some things in your diet and lifestyle. So I don't just work with nutrition. I always also look at sleep. Sleep is really important. If you don't sleep, it's hard to heal. Stress is a big underlying factor for many people. Hydration, not drinking enough water, really important. And then of course movement. If you're not moving, your body can't really heal either. And then it's not that we all need to do like vigorous movement. It could be something gentle. It's very personalized. So yes, all these different things we look at, and then diet, of course. And I think the thing that makes it all doable is to take it in steps and follow what somebody can handle. So with one person who has already done a lot of work, I work very differently from somebody who's still very new to and has like a normal standard diet and needs to make changes. We can start with just small changes and take it from there. And yeah, I really want to make it inspirational for people. Like they can get really excited about things that are actually healthy and delicious, or movement that really works for them. And, it doesn't need to be all hard and terrible. That's just what I wanted to say. Like, I also think it's really important that people get a lot of support. So how I work is, I don't just tell people what to do, but we work in a 3-month program. and we can have daily connection. So people tell me what they're doing, and that's not working, and I ask them to make a small change, and so that it's really tailored, and I think that works a lot better than you visiting me, me giving you a protocol or a list of supplements, and you're going away, and then you're not sure what to do when it's not working. So, hi Kate, I'm waving at you. And so let me know in the comments if you will be interested. I do free calls on Zoom, like a 30-minute call, just to hear a bit more about how you're doing, and just explain how I would work with you. And you always get something valuable out of those calls, and I really hope to, to educate people and to show them a bit like what it could be like. And hi Kate. I think it's always worth giving it a try to book. I'm not going to make you book a whole program or whatever, but it's, if you feel like you could use some support, I think it's really important to just start looking at how that could work. So let me know in the comments what you've been doing so far, and has it been working or not, and where you would think you would need support. And I'll put the link to my schedule in the comments, so you can book yourself in if you want. And I would be really looking forward to seeing you, and looking into what's happening for you at the moment. Well, that's me for now, and so I would say have a nice day and see you soon. Bye bye. Oops.